Hey guys, I'm back and we're going to answer a question. Someone wanted to know, why would I have blood in the urine after I exercise? Okay, let's talk about that. Well, there's several underlying reasons why you would have blood in the urine. It could be an infection. It could be related to an enlarged prostate. It could be something worse. It could be a side effect from medication. But probably one of the most common things that is behind blood in the urine after you exercise is kidney stones. Because here, this kidney stone is not necessarily nice and round and soft. It has little jagged edges. And it's in your kidney, and you're jogging, and that thing is up and down, tearing up the inside of your kidney. So that's usually what it is. So if that is the case, then you need to start doing a couple things. First of all, you want to do prevention. You want to avoid certain foods. And I have a lot of videos on this already. I'll put some links down below. You want to avoid spinach, peanuts, almonds, tea, chocolate, things like that. Now, if it's a uric acid stone, and you don't really know, but it could be a uric acid stone, more likely if you're doing keto, in which case you might want to cut down some of the protein if you're doing large amounts of protein. And also, of course, the spinach and other things too. But if you're prone to kidney stones, definitely drink a bit more water. Stay more hydrated. Potassium citrate is really good, but the best remedy is hydroxy citrate. You can get it at the health food store or online. You take that on a regular basis. That prevents stones, both oxalate stones and uric acid stones, and it also will help to dissolve the stone itself. Potassium citrate also helps, but hydroxy citrate works much, much better. So that's what I'd recommend. So as long as you're avoiding the foods, over time, I think you're going to be fine, and you take this remedy, that should help you. You may want to do a sport that doesn't involve jogging up and down to jar the kidney. So maybe take up biking or some low impact sport while you're dealing with this stone. And then of course, if it keeps coming back, get it checked out. But if it's a one-time thing and you're jogging and all of a sudden your urine is blood and you're like, what the heck's going on? But you have no other symptom, that's probably what's going on. And it usually will go away after you just stop jogging, because the urine is basically filtered blood. And so as soon as you stop jarring it, the body filters it and it'll be a normal color urine. All right, so I hope that answered your question. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.